Now, the UK will receive 10 million doses of the Astrazeneca COVID vaccine, which is being manufactured in India. The UK has ordered 100 million Astrazeneca doses in total, out of which 10 million jabs will be delivered by India. The jab, which has been developed by UK's drug firm Astrazeneca and the Oxford University, is being manufactured by the Serum Institute of India, which is the world's largest vaccine maker. Now, the UK government said that the Serum Institute providing these doses to the country would not affect the firm's commitment to provide vaccines to poorer nations. This, as the Serum Institute is supplying AstraZeneca vaccines to low and middle income countries as part of the World Health Organization's COVAX program. Besides this, AstraZeneca has also committed to delivering 180 million doses in the second quarter to the European Union. The UK was among the world's first countries to launch a vaccination drive. Over 20 million of its residents have received the first dose of a COVID vaccine so far. For more details, let's quickly go across to our correspondent Mandy Clark, who's joining us live with all the details from London. Thank you so much, Mandy, for bringing in your inputs. Now, what can we expect from this rollout? Will it provide the much needed thrust for the UK's vaccine rollout?
Yeah, absolutely. The UK is having the fastest rollout in Europe, and it's already vaccinated 20 million people. AstraZeneca is, as you say, 100 million doses is part of that vaccine program. 10 million doses from the Serum Institute. That's 10% of the required doses. Is a huge amount. And with the speed and efficiency of this vaccine, the vaccine rollout, there just is such a great demand of getting those vaccines quickly to the population. So it's an essential part of the vaccine plan here in Britain.
Right, Mandy, also there are a lot of comparisons being drawn if the AstraZeneca jab is going to be more effective when compared to the Pfizer jab.
Well, it really depends. So far we've seen that Britain made a decision, and it decided not to wait 3 weeks but extend it to 12 weeks. Now, at the time, the World Health Organization had said that it was against their advice and they weren't sure about the efficacy of the vaccine. It turns out that it actually is stronger and works better with that longer gap. But the bigger question, of course, is always the variants. We do know that the AstraZeneca jab is less effective against the South African variant. That is currently not endemic in the UK. But the worry is if these variants get in, that could affect the strength and the efficientness of the drugs.
Having said that, Mandy, how will AstraZeneca now also be jumping to the rescue of EU as we hear reports of 180 million doses being committed by AstraZeneca to the EU?
That's not, yes, the EU very much. There was just a month back, there was a battle about the amount of that they were getting. They felt that the EU was getting put ahead in the queue. That has since worked itself out.
All right, we seem to be encountering some audio glitches with Mandy over there, but those were the latest reports coming from the UK, where AstraZeneca has now jumped to the rescue of the UK vaccine rollout. And with that, there's, of course,